Hello everyone, welcome to my YouTube channel. Today's topic is about a condition called celiac disease. It's done by me, Riyad. Now these are the objectives that I'm going to talk about, but first I will talk about the condition itself. Now celiac disease is a small intestinal immune-mediated enteropathy caused by intolerance to ingested gluten, a storage protein found in wheat, barley, and rye. Genetic, environmental, and immune factors play a role in the development of celiac disease. The main treatment is strict, lifelong adherence to a gluten-free diet. It can occur at any age and present with a wide range of symptoms. It is characterized by both gastrointestinal and extraintestinal symptoms. Chronic inflammation resulting from exposure to gluten causes GI discomfort, nutrient malabsorption, and systemic complication. If you can see in these two pictures, the left picture is normal, the villi here is normal, whereas in the right picture, the villi of small intestine is atrophied and narrower. If you come to the epidemiology part, celiac disease is now being diagnosed more in adults and children due to increased awareness and better diagnostic techniques, challenging the previous notion that it mainly affects children. The prevalence of celiac disease is higher in Europe and North America, particularly in the United States, where it ranges from 0.71% to 0.79% and affects up to 1% of non-Hispanic whites. Females are more commonly affected by celiac disease, with a ratio of 1 to 2.8 compared to males. Over the past 50 years, there has been a significant increase in the prevalence of celiac disease in Finland and the United States, with a fourfold increase observed. The widespread consumption of wheat in diets, along with the prevalence of HLA-DQ2, a genetic marker associated with celiac disease, may contribute to an increase in its prevalence globally in the future, particularly in regions where it is currently rarely diagnosed. Now, etiology part. Celiac disease occurs when individuals with a genetic predisposition consume gluten. Gluten consists of two types of proteins, gliadin and glutenin, primarily found in wheat. Similar proteins called hordeins and siccalins are present in barley and rye, respectively. Wheat, barley, and rye, which belong to Triticia tribe, trigger an autoimmune response in individuals with celiac disease. Oats from the Avinia tribe contain fewer disease-activating proteins compared to wheat, barley, and rye. Oats may be at risk of gluten contamination during the manufacturing process. This table presents to you what foods contain gluten and what foods do not contain gluten. Our concerns is about the food that contain gluten, such as wheat, barley, and rye, as I said, and oats, and others. Genetic factors in combination with exposure to gluten are necessary for the development of celiac disease. The concordance rate in monozygotic twins is 85%, suggesting a significant genetic component in the disease. Other factors besides genetics are also likely to be involved in the development of celiac disease. Virtually all patients with celiac disease have variants of HLA-DQ2 or HLA-DQ8 molecules expressed on the surface of antigen-presenting cells. These HLA-DQ2 and HLA-DQ8 variants are commonly found in individuals with celiac disease. Other non-HLA genes may also contribute to enhancing genetic susceptibility to celiac disease. Various infections like gastrointestinal, upper and lower respiratory infections are risk factors for the development of celiac disease. Also, certain drugs such as olmesartan, azathioprine, methotrexate, and many others may potentially contribute to the development of celiac disease. Now, what happens in normal situations? Enzymes in the small intestine, as we know, they are responsible for breaking down food peptides during digestion, preventing potential harm. The intestinal epithelium acts as protective barrier against large molecules. Now gluten, which contains glutamine and proline, is resistant to digestion, but it is typically eliminated without causing an immune response. In individuals without celiac disease, the limited passage of gluten through the intestinal barrier usually doesn't lead to a significant immune response. Now coming to the pathophysiology, what happens actually with patients with celiac disease? Celiac disease involves interaction between gluten, immune factors, genetics, and the environment. The compromised intestinal epithelium in individuals with celiac disease allows gluten to reach deeper layers, triggering an exaggerated immune response. This immune response occurs in individuals with HLA types DQ2 or DQ8 and involves both adaptive and innate immunity. The specific mechanism of intestinal damage in celiac disease is still being studied. Now, non-celiac gluten sensitivity causes symptoms like celiac disease without having the disease. Diagnostic evaluations including celiac serology, small intestinal biopsy, and HLA-DQ typing are necessary to differentiate between non-celiac gluten sensitivity and celiac disease. Accurate identification of non-celiac gluten sensitivity is crucial for proper treatment, monitoring, evaluation, and family counseling. Unlike celiac disease, non-celiac gluten sensitivity is not highly hereditary. Now, what happened actually, if you can see in this picture, this is the intestinal epithelium. Now, toxic gliadin protein in wheat, gluten, play a vital role in driving celiac disease by triggering changes in the epithelium and lamina propria through innate and adaptive immunity. Now, tissue transglutaminase serves as the main target for the autoantibodies and also act as an enzyme that enhance the immunostimulatory effect of gliadin peptides. This is the gluten pepticles and this is the transglutaminase. This happened by deaminating glutamine. Now, individuals with celiac disease experience increase in tissue transglutaminase activity in the mucosa. Deaminated gliadin peptides bind to HLA-DQ2 or HLA-DQ8 on antigen-presenting cells, initiating the activation of gliadin-reactive CD4 T cells. This activation leads to cytokines production, tissue damage, and villus atrophy, crypt hyperplasia, and expansion of antibody-producing B cells, all of which contribute to the development of celiac disease. Now coming to the signs and symptoms of celiac disease. Both children and adults will experience classical gastrointestinal symptoms, but adults will more likely to experience atypical symptoms. For example, adults and children will experience constipation, abdominal pain, chronic diarrhea, vomiting, irritability, etc. If you can see in adults, they will experience atypical symptoms like peripheral neuropathy, depression, fatigue, malaise, ataxia. There might be weight loss, infertility, dermatitis, herpetiforms, hepatitis, anemia, malignancy, seizures, osteopenia, osteoporosis, arthritis. Also in children, there will be anemia, hepatitis, osteopenia, osteoporosis. At the end, I will say that both children and adults will experience classical gastrointestinal symptoms, but adults will more likely to experience atypical symptoms, less in children. Coming to the diagnosis, how is diagnosed? Clinical suspicion, serology, for example, deaminated gliadin peptide. We will test for IgA or IgG antibodies and antibodies against tissue transglutaminase activity. Also, genetic testing. these two variants, HLA-DQ2 and HLA-DQ8. Also duodenal biopsy, and the main treatment, as I said previously, is gluten-free diet. Now, diagnostic testing for celiac disease should be conducted while the patient is still consuming gluten. A confirmed diagnosis of celiac disease typically involves two criteria: a positive finding on duodenal biopsy and a positive response to a gluten-free diet. The identification of villus atrophy through small bowel endoscopy and biopsy, these two considered a gold standard for the diagnosis of celiac disease. General approach to treatment. The strict lifelong adherence to a gluten-free diet, as I said, is the mainstay of treatment for celiac disease. Supportive care should be provided to address nutrient deficiency, which may involve drug therapy or other interventions. Preventive care measures such as recommended vaccines, I will tell you about the vaccines later on, should be implemented to ensure overall health and well-being in individuals with celiac disease. Coming to the non-pharmacological treatment. If you think about the celiac word itself, it is actually have a meaning. Each letter carry a meaning. So C for consultation with a skilled dietitian, E for education about the disease, L for lifelong adherence to a gluten-free diet, I for identifying and treating nutritional deficiencies, A for access to an advocacy group, and C for continuous long-term follow-up by a multidisciplinary team. Coming to the pharmacological treatment, novel pharmacological treatment options are under investigation. Current reports on pharmacotherapy for celiac disease primarily concentrate on treating refractory cases. In case reports, the following treatments have been reported as effective for refractory celiac disease: corticosteroids, azathioprine, cyclosporine, tacrolimus, infliximab, and alemtuzumab. Refractory celiac disease refers to patients who experience persistent or recurrent malabsorptive symptoms and signs with villus atrophy, despite following a gluten-free diet for more than 12 months. Less than 5% of adult patients are diagnosed with refractory celiac disease. So, other treatments: decreasing the antigenic load, blocking the activity of tissue transglutaminase, enzyme therapy for gastrointestinal destruction of proline peptides, blocking the binding of deaminated proteins to HLA-DQ2 and HLA-DQ8, detoxification of gluten peptides, decreasing intestinal permeability through inhibition of zonulin. Zonulin inhibitor larazotide, well tolerated with varying efficacy in 3 phase 2 studies. The vaccine is Nexvax2, completed phase 1 studies modulating the immune response. This vaccine is good for a patient who already experiencing the signs and symptoms. It will suppress the signs and symptoms. This is the end of today's session, and this is the reference. Thank you for listening. If you have any question, comment in the comment section. Also, if you have any other medical ideas that you guys want me to do, I will gladly do it. And please don't forget the subscription button and like button, and share these videos with your friends, families, and see you in the next video.